Hello, good evening. Welcome back to MyIVFanswers and the European Fertility Society. We are back once again today, and I'm really happy to have you all here with us. And we are going to talk about social freezing in Czechia. And we are connected with our special guest and expert today. You can see him right here. Dr. Tomáš Koukal is with us. Hello, Dr. Tomáš. Lovely to have you. Hope you had a good evening, a good day so far, and are ready to discuss this topic with us today.
Hello, hi, nice to meet you, Carolina, and hello everybody. Yeah.
Thank you so much. And of course, we will start with the presentation on our topic, but afterwards there will be time for your questions. So please remember to put your questions in the chat. And Dr. Koukal will definitely answer them for you right after the presentation. And I also would like to add that Dr. Koukal is the fertility specialist at UNICA in Brno. So we are connecting today from the clinic. It's quite late, but I'm really happy that we are able to have you here and to discuss this, as we know that this is a topic that definitely brings lots of questions. This is still, I would say, not a popular treatment, but I'm really happy that we are able to spread the word about it, that something like that exists, and people can find out a little bit more. So remember, it's all being recorded and it's all anonymous. So we are definitely happy to have any questions from you, and we will be definitely happy to answer them. So don't hesitate. And I think we can start with our presentation. Let me know if you can see it, and we can start.
Okay, so thank you again, Carolina. Thank you very much for this opportunity to be here with you and with the patient. And good evening to everyone from Brno, Czech Republic. It's my pleasure to present to you more details about the egg freezing topic. So let's start. What agenda will be discussed this evening and which topics will be covered? These four areas. Yeah? What is the egg freezing? Why do we freeze eggs? Who is recommended for this procedure? And how is this procedure done? Okay, so the first point to be discussed is the description of egg freezing, or let's say fertility preservation or social freezing. It is a fertility preservation process where a woman's eggs are collected, frozen, and stored for future use. And when the time feels right, the frozen eggs will be unfrozen and used to conceive via in vitro fertilization. Why are we talking with our patients about egg freezing? Because over time, the quality and quantity of eggs declines. And via egg freezing, we can solve this problem. On the topic of egg quantity, how can we detect it? Via anti-Müllerian hormone, which is the best measure of ovarian reserve. Few facts about the AMH. This hormone is produced by granulosa cells in ovaries at many stages from primary to early antral stage of follicles. The concentration of AMH in blood is directly proportional to the number of antral follicles. AMH is a better indicator of ovarian reserve than FSH, inhibin B, or estradiol measured on day 3 of the cycle. And blood AMH levels do not change significantly either during the menstrual cycle or between subsequent cycles. And finally, from AMH levels, we can estimate how the ovaries will respond to IVF stimulation. 。 Who should be tested via anti-Müllerian hormone? All women interested to know what their ovarian reserve is or have doubts about it. All women age over 30 years. All women with reduced antral follicle count or predominance of ovarian stromal issue on ultrasound. All women after ovarian surgery, cytotoxic treatment like chemotherapy, etc., etc., and all women with ovarian endometriosis. Here on the graph, we can see the anti-Müllerian hormone levels declining over time as a woman ages. On the bottom, we can see increasing age, and on the left side, we can see AMH levels. This graph is important because it shows clearly decreasing AMH levels as women get older. Now I would like to talk about the quality of eggs. On this graph is relationship between the patient's age and genetically normal embryos. Because only the genetically normal embryos can lead to the healthy pregnancy and to the healthy baby in your home. And we can see the accelerated decline after age 35. So it's clear that the higher maternal age is associated with the lower embryo quality, with the increased genetic abnormalities, with a higher risk of miscarriages and reduced implantation success. And steep decline in euploid embryos begins after age 35. This slide shows us a predictive model to estimate the number of mature oocytes needed to obtain at least one euploid blastocyst for transfer in couples undergoing in vitro fertilization. And there is clearly visible difference between younger women as seen in top curved line compared to the bottom line which shows older women. And by comparing these women, we can conclude that 28-year-old woman needs to collect circa 3 oocytes to have a 70% chance of obtaining at least one euploid blastocyst, while on other side, a 44-year-old woman needs to collect approximately 34 oocytes to achieve the same 70% chance. So it is the big difference. In this easy slide, we can see the normal oocytes in green and abnormal in red. As it shows, over time the quantity decreases and the number of normal oocytes decreases as well. Who is recommended for this procedure, for egg freezing? Historically, it was on the first place the cancer patients, women undergoing treatment like chemotherapy, which are encouraged to consider egg freezing beforehand. The next could be recommended for career-focused women, which are preserving options while building a professional life. Next, for the awaiting woman awaiting the right partner or single woman, women not yet ready to build the family. There are some specific situations. If we have here the couple treated via IVF, and there can be some problems on the male partner side, like a health condition, traffic jam, and he is not able to be here on time. So, and we have already collected eggs, so we have to freeze his wife's eggs and to save these collected eggs. Yeah, and next could be recommended to do this procedure for patients with family history of early menopause to ensure that they have viable eggs for future use. What is initial analysis before this procedure? This is AMH blood test taken on any day of the menstrual cycle, and vaginal ultrasound, which can assess ovarian structural issues, how many eggs can be retrieved, and antral follicle count. How many eggs we want to achieve, or what is our preservation goal for optimal future chances? This is between 15 and 20 mature eggs. However, this goal should be specified individually, especially with the respect to age. See the previous slides. Yeah. What does the process look like? Yeah, in first step is done the initial consultation, and we are doing the evaluation and planning all steps. From beginning of the menstrual cycle is hormone stimulation started. It means for 10 till 14 days using injections to prepare the ovaries for growing follicles. Yeah, in this time, or in this period, is done mostly 2 times ultrasound scan to detect how many follicles there are in growing process. If there is if there are the sizes of follicles in optimal sizes, so we have a plan for the egg retrieval. What is the 10 or 15 minutes procedure under general anesthesia, and after the collection of these eggs will be vitrificated for preservation. And after few years or after many years, these eggs will be unfrozen and can be fertilized via sperms, and approximately 5 days after this fertilization is done, the embryo transfer, or can be done the preimplantation genetic testing of aneuploidies of embryos. With this procedure, we can detect which embryos are genetically normal and which embryos are genetically abnormal, and for the future will be again cryopreserved the only genetically normal embryos, which can only these embryos can lead to the healthy pregnancy. What does the stimulation process look like? Yeah, the first step is the stimulation is started from the second day of cycle. there is the self-administered hormonal injections to stimulate the growing of follicles. Next, during this 10 or 12 days period will be done the 1 or 2 ultrasound controls during stimulation, and in case will be there the optimal sizes of follicles will be done the plan for the egg collection. Before this should be done the trigger shot injection, which is used approximately 36 hours before the egg collection, and after that the egg collection is done. What does the egg collection procedure look like? It's typically done on between days 11 till day 15. This procedure means that the woman will be at our clinic approximately 2 or 3 hours. This procedure is performed under general anesthesia, so is fully painless, and the recovery time after this procedure is very quick, and she can return to normal activities very quick. Now I will describe to you the case report. Number 1. There was the 38 years old HR manager. AMH has below 1, so a bit lower than normal range. There was a pure follicle count. There was a healthy BMI range. Next condition, there was the thrombophilia mutation of factor V Leiden, and she was motivated for oocytes freezing because she found the new boyfriend, but not sure whether to conceive with this partner yet. There was done the first stimulation in November 23. We've been used the short antagonist protocol with 300 units from day 2 till day 11. Due to the thrombophilia, there was used enoxaparin injections. It was the antagonist protocol, so we've been used 𝐬𝐮𝐿X injections, and the trigger shot injection was used via triptorelin. And in this stimulating period, there were 2 times where ultrasound folliculometry is done, and oocyte pickup was done on day 13. And the result was that there were 13 follicles in growing process, 11 oocytes were achieved, and 9 M2 oocytes were cryopreserved into 3 straws. After that, 3 months later was done the stimulation number 2 with same protocol, 300 units of combinated gonadotropins. Enoxaparin was used again, 𝐬𝐿X as well, and the trigger shot via triptorelin. And again, there were 2 ultrasound folliculometries on day 7 and day 10. One difference between the first and second stimulation cycle was that the egg collection, the pickup of egg collection, was done on day 14, and there were in the results 9 follicles in growing process, 7 oocytes were achieved, and 6 good mature oocytes were cryopreserved into 2 straws. So finally, from this first and the second stimulation, there were 15 oocytes cryopreserved for this lady. Second case study is there was the 34 years old IT specialist. Yeah, there was very good AMH level and high follicle count. There were no healthy condition, and she was motivated because she finished long-term relationship and she wants to proactively preserve fertility. We've been used the short protocol with antagonist, and we've been used 150 units, the 𝐬𝐮𝐬𝐜𝐫𝐤 injections, and for trigger shot was used the triptorelin. 2 times there were done the ultrasound folliculometries, and the oocyte pickup under general anesthesia was done on day 14. So the result, there were 19 growing follicles, 17 oocytes achieved, and from this, after the cleaning of the cells from the oocytes, the 16 M2 oocytes were cryopreserved into 4 straws. So, in conclusion, let me say that the oocyte cryopreservation by vitrification, commonly known as egg freezing, is a safe and effective way to preserve the quality of oocytes for future use in IVF treatment to conceive a child at the right time. Thank you very much for your attention, and your questions are welcome.
Sorry, I'm here. I can hear you. Thank you so much indeed for your presentation and also bringing those cases, because I think that many patients definitely appreciate to be able to see how it worked for one patient to the other. So thank you for bringing this up. And now we will go for your questions. So please go ahead, type those in. We have definitely some time to answer any of your questions in regards to our topic today. I do see one question, but I will give you a little bit more time for them. And in the meantime, I do have some questions that I would like to ask you before we go ahead with your questions. So basically, of course, you mentioned this before during your presentation, but just to summarize, so how many eggs should be frozen, and would one cycle of egg freezing, is it enough? One cycle of egg freezing is enough?
It's very individual, yeah, and in case that we have not enough of eggs, if there is no our goal achieved with the respect the age, we are talking about the next IVF next cycle. So it was in case report described. So we have few patients where is the second IVF stimulation needed to collect the suitable the good amount of eggs to be sure that for the future there will be enough of eggs to develop the good amount of embryos.
Definitely. Yeah. So it's individual and it's very based on what your current, let's say, AMH levels and also intrafollicle count, etc. Right. So this is individual.
Yes.
We need to
Yes.
remember that. Okay.
Yeah.
And
Yes.
I guess more often it happens that you require at least those 2 stimulations to obtain the enough number of eggs as well, I guess, right? In general.
In general, depending on the inclusion or in incoming AMH level,
Okay.
especially, and which is depending on the age of woman. So in general, let's say approximately 50% of women should to have the minimally the second stimulation to collect the enough of eggs.
Yeah. Okay. Thank you for that. And I know that we've covered this, of course, topic before, and we still receive many times this question: is the egg freezing painful? Is the process painful? And are there any side effects?
So some procedure of egg collection is painless because it's done during under general anesthesia, and after the procedure, the woman is monitored on the recovery room, and if there will be any pain, we can use the painkillers. So the goal is to do it without the pain, of course. There can be some symptoms with connected due to the IVF stimulation, because the ovaries are enlarged, so there can be some strange feeling in the underbelly, and but all these symptoms are temporary and will be, especially after using the trigger shot, the triptorelin. So it means after using for the trigger shot the agonists, we cannot see at this time or today, we cannot see no ovarian hyperstimulation syndromes. Yeah, it's a rare situations, because we are using the agonist injections for trigger shot.
Yeah. Okay. Thank you so much. It's again important to mention that, because many times I think that many women are afraid of the HSS, but as you said, it's something that doesn't happen too often nowadays, so you shouldn't be worried.
And if there was, your question was about the complications.
Yeah, I mean side effects, any complications as well.
Side effects, yeah. So there are some myths that the egg freezing, the social freezing can be dangerous for a regular menstrual cycle, or there it's the myth, yeah, it's the false, yeah, because the menstrual cycle will come back to the regularity very quickly. Yeah, so there is a question if there will be all eggs disappeared after the IVF, after the egg collection. So it's false. Yeah, so there are more and more eggs, and especially in ladies where is the very poor ovarian reserve, the one IVF stimulation cannot cost that the eggs will be disappeared, yeah, in total. Yeah, it's false.
Yeah, this is so many misconceptions that are out there, of course. So this is something that you shouldn't worry about, right?
Yes.
Any other misconceptions that you've heard? Perhaps if we are still on this topic, just to
next about that it is dangerous. Yeah, it was answered already, or painful. So it was answered. So yeah.
Perfect. Thank you so much. And if we can also just repeat to everyone about the legal aspects of age and storage duration when it comes to egg freezing in Czechia.
So in Czech Republic, this procedure can be done until age 49, but of course as you could see in my presentation. So the best age for this procedure should be from 30 till 35 to be sure that the quality of eggs will be good and will be optimal to conceive with the genetically normal embryos in the future. And the legal, this procedure in Czech Republic is possible to do for every woman. There is no, this procedure is no covered from healthy insurance, and so should be this process should be paid from patient, and of course I was talked about the 49 age limit, but after the 35 or after the 40 is a bit problematic to do this process, but we can do it. But for the future, before the embryos will be used, should be recommended to use the PGTA procedure to detect what is the genetic profile of embryos.
Definitely. And actually, I will ask you this question that we have in the chat. So at what age, we already explained that, but what age does it make the most sense to freeze the eggs? Is it still worth it at 40? And if I don't have a partner, how many eggs should be obtained? So at 40, let's say. So can you answer that question?
I will answer it. I have to take a help. So this graph, there was in age 40 there can be the 70% chance to obtain minimally one genetically euploid blastocyst if there will be approximately 15 eggs collected. So let's say in age 40 we should to collect minimally 15 eggs.
Yeah. Okay, Helma, thank you so much for your question. I hope that helps. So it's not, as you said, 35 would be the preferred kind of age, let's say up to 35 to be able to obtain enough eggs, let's say, right? So this is definitely an important part.
Yeah. So
and
unfortunately, the age, we have to talk about the age with our patients every day. And I am very sorry that I have to talk about this because it's a bit sensitive issue. And but the age is crucial, and the age in our area, in our reproductive medicine is the crucial factor.
Yeah, of course,
because
that's why
our goal is not only the pregnancy. Our goal is the healthy baby in your home, and it can be done if there are the genetically normal embryos, and again we are talking about the age.
True. So this is how it is, of course, right? So we need to keep that in mind. Someone is typing, so I guess we will have some other questions. So please go ahead if there are more questions. You know what to do. And in the meantime, I would also like to ask you. So, are you able to tell us how often do you see women? Are there any women that are maybe around 20 something, and they are actually coming, or are those ladies who are rather over 30, if you were to look at it?
So these ladies between, for example, between 25 till 30, this group of patients it's a very small group, yeah, and the most of our patients are 35 and more.
Yeah.
So
And more and over.
35 plus until 40, and it means this is the most part of our age profile of our patients. Yeah.
Yeah, and this is how it is. So thank you so much for answering that additional question. We have another, well, if you can have a look right in the chat, age 43, AMH 8. I'm not sure which units, but AMH 8, is that sufficient? This is the question from Hazel.
And the AMH 8, it is the question. So depending in which units was measured, yeah. And in my graph was the AMH levels in nanogram per milliliter. In these units, it's very good ovarian reserve. In case, especially in UK, are measured this anti-Müllerian hormone in picomole per milliliter, and let's say it can be on the border of the normal range. So depending which units was used for this measurement, but in case it was in a nanogram per milliliter or micrograms per liter, it's very good ovarian reserve. The AMH 8 nanogram per milliliter or 8 picogram per liter is very good. Yeah.
So that would be sufficient in that case, let's say,
Yes.
right?
Yes.
Okay. If it's, as you said, picomoles in UK measurement, then no, right? Just to clarify.
It's on the border, yeah, and depending what is the age of the lady.
43.
43. Yeah, it can be. Let's say, let's talk about the possibility. If there is the interesting to do the social freezing, I say yes, let's to do it. Better now than never, yeah, and it means that there can be the possibility to detect or to have a test for the embryos in the future if will be needed, or to do the PGTA, but the first step should be to collect the eggs.
Right. Okay. Thank you.
I recommend let's try it. Yeah, let's try it.
Yeah, in this case, right, you are totally right, of course. Hazel, if you have any follow-ups and you can share with us the measurements, of course, go ahead, you can still do that. And again, I would like to encourage you for more questions. If you have any, go ahead, type those in. And yeah, there is another question just came here. Is that rare? Okay, this is the question. Age 39 to have more than 3 euploid embryos.
To have more.
Can you see it?
So yeah, I can see this question. So I think that in this depending how many eggs we're collected, yeah. So and it can be possible, depending. All is dependent on the quantity of eggs. What is the AMH level? So I think that to collect or to achieve the 3 embryos, the 3 euploid embryos in age 39 is possible. But depending is what is the initial parameter of anti-Müllerian hormone, or how many eggs can be collected. So depending what is the ovarian reserve.
Yeah.
Yeah.
Definitely. And there's just waiting to see if there's anything else, but I don't see more questions. So we will be slowly finishing. However, I would like to give you a little more time for your questions. And in the meantime, can you also tell us, so because I also sometimes heard about the decline, about when it comes to egg quality after thawing. Can you tell us a little bit on this?
So let's say in the past, especially in the past, there was no we knows that there was the eggs are the most fragile cells for the cryopreservation, but with the vitrification techniques, the survival rate after the unfreezing is about 90 to 95%. So today, let's say for embryos, it's much higher, but via vitrification, we can say that the survival rate after the unfreezing of eggs is about 90 to 95%.
So still high, of course, so there's nothing else that you don't need to worry about it for sure, right? So thank you for the clarification. Yeah. Okay. I don't see more questions, so we will be finishing for today. However, I would like to thank everyone for joining us. I do believe it was useful for you, and I'm really happy that we are discussing this topic. As we know, as you said, women decide to actually go ahead with this after 30. So it's always good to discuss it and spread the word and say that there are some options available for women who want to just preserve their fertility, right? So any final words before we finish for today?
So let me say, please don't hesitate to contact any IVF clinics, yeah, because let's have any consultation on IVF clinic, and you can see what are your possibilities, and is better to discuss about this, and if there will be any chance to do it, so please let's do it.
Definitely. Thank you so much indeed. And remember that if you have any more questions, you will be able to simply get in touch with us directly. We'll be happy to help you out. And I'm sure Dr. Koukal and his team at UNICA, they will be also happy to hear from you if there are anything else that you would like to know. So thank you everyone for joining us today. Thank you for your time, Dr. Koukal. And of course, I'm really looking forward to some more events with you. It was a pleasure to have you. This is your first event with us, so I'm really looking forward to some more. And have a lovely evening, everyone. Okay, take care. Speak soon.
Thank you very much, and have a nice evening. Bye.
Take care. Bye.
Bye.